Hello, everybody, and welcome to Spay Neuter Network Live. I am Dr. Mark Stickney, broadcasting to you from the Spay Neuter Network studio in San Antonio. And it is so good to have y'all here with us today. As usual, we're going to go through some of the exciting things we have going on at Spay Neuter Network, and we will answer your questions, and I will impart some interesting little facts and tidbits to you as we go along as well. So I'll tell you what, it is hot outside. I think this is the hottest week that we have had in San Antonio. It is just crazy out there. So remember, if it's hot to us, it's hot to our pets as well. And we want to make sure that they are able to stay cool enough and get in and get indoors as they need to. A few different things going on this week at this month at Spay Neuter Network, and one of those is that August is National Immunization Awareness Month. So this is a month to think about being immunized, and for our pets, that includes their shots as well, their puppy and kitten series, and then their yearly vaccinations. In honor of this month, we are giving $5 off Bordetella vaccines all month long at all of our clinic locations during wellness hours. And if you are in San Antonio, our new wellness hours are 10 a.m. to 2 p.m. So that would be the time to bring your pet in. Bordetella vaccines are $5 off. This is also National Give a Dog a Bone Week. So everything is expensive nowadays. It's just crazy. I went to the grocery store, paid for the groceries, and I looked at the cart and I was like, I don't feel like I have that much stuff that I just paid for. So it's can be a real challenge sometimes. So if you know anybody that needs help with pet care or pet food, Spay Neuter Network has resources available on the website that may be able to help you. Our website, of course, is spayneuternet.org, and there will be resources and information there for those. We have 3 vaccine clinics coming up this month on Saturdays. The first one is this Saturday at Dallas Animal Services from 8 a.m. to 11 a.m. They will be giving free FVRCP vaccines for kittens and cats and free parvo distemper vaccines for dogs. There will be other vaccinations and preventative medicines available at low cost as well. So that is this Saturday. And then coming up on Saturday, August 24, there are vaccine clinics going on at 2 different locations. One of those is at Sycamore Park in Fort Worth, where we will be doing the same thing again. There'll be free rabies vaccines, free FVRCP, and free parvo distemper vaccines, and other things will be available at a low cost. That will be at Sycamore Park in Fort Worth from 8 a.m. to 11 a.m. And then if you're here in San Antonio with me, we also have one coming up on August 24, and it is again from 8 a.m. to 11 a.m., and it will be at the South San Antonio Community Center. And I will be there. So if you would like to see me in person, that's where I will be. So all of those vaccine clinics are going on. They all have free vaccines for cats and dogs, plus other vaccines at a low cost. And that is all to recognize National Immunization Awareness Month. Vaccinations are the second most important things that have saved lives, both animal and human, after the discovery of fresh, clean drinking water. The number 2 thing that helps keep people alive are vaccines that prevent you from getting terrible diseases. And it's great when we're able to do those kinds of things for our pets. I mentioned earlier at the beginning of things that it's really hot outside, and I wanted to touch base on just how important it is to keep our animals nice and cool during this time. It is hot enough that just to walk outside, it's just really uncomfortable. And we'll go outside, we start to sweat to cool off. Our pets go outside, especially our dogs. They go outside and then they have to pant to cool off. And panting is a good way to cool off, but um, because when a dog pants, it is taking in air that's the air temperature it is outside. So in the case of San Antonio today, 100-degree heated air, panting will only get them so far. So you want to make sure that your pets always have fresh water and an opportunity to get out of the heat. I recommend no more than 20 minutes outside right now during this time of the year before they come inside and have an opportunity to cool off. This is especially true if you happen to have a brachycephalic dog or those dogs that have the punched in noses. So, French bulldogs, pugs, Boston Terriers, any kind of a dog that has not very much nose, that's considered a brachycephalic dog. And those dogs are especially prone to overheating for several different reasons. Part of the reason that they are brachycephalic and have those shorter noses, that means that they still have the same amount of nose as a dog with a longer nose, but it's all packed in real tight. So because of that, it is harder for air to flow through their sinuses, and those breeds of dogs also tend to have a smaller tracheal diameter than a dog that has a that is not brachycephalic. So instead of having a trachea like this, the brachycephalic dogs will be more like that. So they're already having trouble moving that air into their lungs to pant in the first place. So they can get overheated really, really fast. So you especially want to keep an eye on them. The concrete is very hot. Once the temperature gets above 80 degrees, it can become uncomfortable for our pets to walk on. And today, it would be very, very hot for our pets to walk on. So, especially if they don't go for walks very often. So, you want to take your dog for a walk in the evening when the sun has started to set, or in the morning before it gets too hot, so that they don't get blisters and are uncomfortable on their feet. Some dogs will actually tolerate wearing little booties that they make to protect their feet, and that may be an option for your pet. Also, never leave your dog or your cat or a human in the car during weather like this. In 10 minutes, the temperature in your car can raise 20 degrees. So that means that I am out and I decide I'm just going to run into the grocery store, real quick, or the convenience store real quick. And I think we all know that real quick always means there's a long line and someone who doesn't know what they're doing, and it just turns into a much longer time. And the next thing you know, it's been 10 minutes and the inside of your car is now 120 degrees if you're here in San Antonio today. And that is dangerously hot, especially for our pets that have to pant, because that air temperature just keeps going higher and higher and higher, and they're not able to get cooler at all because of that. And then within 30 minutes, the inside of a car can be 130 degrees or more, depending on how hot and how humid it is outside. So never, ever, ever leave anything alive in a car during this time of the year. Because terrible things will happen. Dogs that go into heat stroke because they get too hot, their body temperatures will rise. A dog's normal body temperature is 101.5 degrees, plus or minus a little bit. They automatically run higher than we do. When a dog gets into a heat stroke situation, their body temperature can go all the way up to 107. And I have seen cases where it was so high that the digital thermometer couldn't even read how high the dog's temperature was. When things get that hot, that is the temperature at which their internal organs will actually start to cook at that point in time, and they will go into organ failure. So and that can happen. That can happen if they get overworked on just outside on a hot day. So it's especially a problem if they get overheated in a car. And it's very, very sad when that kind of thing happens. And it doesn't always, it has a poor prognosis generally. So just avoid that in the first place. So always keep your pet with you. Always think about keeping them cool with you. 20 minutes tops outside right now. Always fresh water to drink, no matter what. Let's see here. We have some questions that have come in. So let's see. How often should you deworm a dog, and can you buy over the counter dewormer? So the answer to the second question is yes, you can. The dewormers that you can buy over the counter, they are good, but having a veterinary product is better. And deworming is something that we can do at a very low cost at any of our spay neuter network locations. So we would be happy to help you with that. The answer to how often should you deworm a dog: puppies and kittens should be dewormed every 2 to 3 weeks until they're about 4 months of age. They are very prone to picking up gastrointestinal parasites, GI parasites like hookworms and roundworms, and we want to clear those out of their system on a regular basis. The reason we say 2 to 3 weeks is because that is the time that it takes from a mature worm to lay its eggs and then for those eggs to hatch and now have infective new worms. So by doing it every 2 to 3 weeks, we stay ahead of that life cycle of the parasite and are able to keep our pets parasite free. When they are older, we typically will recommend deworming them yearly. If your pet is on heartworm prevention or flea control, those actually have a monthly dewormer in them. So your pet's being dewormed on a monthly basis in that case. So one more good reason to always have your pet on prevention, heartworm prevention and flea prevention. But yes, you could certainly pick that up over the counter if that was more convenient or something you wanted to do as well. All right. Well, it is National Immunization Awareness Month, and we are giving $5 off of Bordetella vaccines this month. And let's talk a little bit about Bordetella and what that is and what it does. So, Bordetella is a bacteria that is spreads from dog to dog through nasal oral contact. So when dogs come into close contact with each other, when they cough in each other's vicinity, it's just like when someone sneezes that has a cold, right on you in the elevator. And you roll your eyes because now it's coming your way. And it's the same thing with dogs. The Bordetella bacteria affects their upper respiratory tract, so their trachea, their larynx, their pharynx, and it causes irritation there. And dogs that have kennel cough or Bordetella will develop a very deep honking cough. It sounds like a goose honk, and it can be persistent. It can go on and on and on. It will keep your pet up at night, and it will keep you up at night. Most of the time, Bordetella will clear itself in about 14 days. There are things that we can do to help it to make it go away faster and reduce the symptoms of it. And some of those things are to treat with appropriate antibiotics that will penetrate the respiratory tract and be specific for the Bordetella bacteria. Another thing that we can do is give antitussives or cough medications so that tissue all has a chance to rest. Because every time I cough, if I already have a sore throat, we've all coughed when we have sore throats, and we know it just hurts that much more. So, and that causes irritation and more inflammation, which then makes you cough more, which is just a vicious cycle. So we can help reduce that with cough suppressants, and those will be the major things that we do. Once a dog has Bordetella, it will be infectious around other dogs for up to 2 weeks. So that is a long time for a dog to spread it from dog to dog. One of the best ways that we have to prevent Bordetella or kennel cough is with the Bordetella vaccine. And the one that we use at Spay Neuter Network is a nasal vaccine. So we squirt that up the dog's nose, and that then it works directly on the nasal mucosa there and stimulates the immune system, so that if the dog is exposed to that bacteria, the immune system is already ready to go and start fighting that off, and it will either prevent the disease, or if they are still going to get it, it will drastically reduce the signs and the duration that we have those signs. So it will benefit us no matter what. Any dog that is exposed to strange dogs should get vaccinated for Bordetella. That includes if they're going to be at a boarding facility, if they go to the dog park, if they go to puppy kindergarten, any place where they are going to be around other dogs, they are likely to be exposed to it, and having them vaccinated is a great idea. A lot of places actually require you to have those vaccines before they will even let your pet come in. If you are going to be in a high exposure environment with your pet, then you want to revaccinate them every 6 months. So Bordetella is one of those vaccines that we provide at Spay Neuter Network, and this month they're $5 off. If you've been thinking about it, if you're going on vacation, if you're traveling and going to have your dog around other dogs, definitely now's a great time to give that vaccine and get it done for your pet. Most of the time, kennel cough is a self-limiting disease, which means that it's just like we get the cold, um, and it's no fun, but it's going to run its course, and that's usually what happens with kennel cough as well. However, sometimes that bacteria will travel down into the lower respiratory tract and get into the lungs and can result in pneumonia. And now it's a much more serious thing than if it's just in the trachea and an irritating cough, because pneumonia can make you very, very sick, and untreated it can certainly lead to death. So you want to keep an eye on your pet. If they are developing that cough and you can't miss it, take them to see your veterinarian to start some antibiotics and some cough medication. And brachycephalic dogs, again, those dogs that have the little punched in cute faces, they are, because they have a smaller trachea to begin with, we talked about that, they are more likely to have complications relative to the bordetella, because they already have a smaller trachea to begin with, and now that gets swollen, so it actually gets smaller and smaller and smaller, and they can have some trouble breathing, and it can really lead to more serious problems there. So those pets are definitely going to want to be treated sooner rather than later. The distemper parvo vaccine that we are giving away, that we're giving for free at our 3 vaccine clinics this month, is a vaccine that also treats for one of the common viruses that causes part of the kennel cough complex, and that's called parainfluenza. When you see the vaccine DHPP, the P is for parainfluenza, and that is a virus, much like the cold is a virus. The common cold that we get is a virus, and it can lead to the same types of signs, that irritating cough, and this is another thing that we can vaccinate for to help prevent our pets from having any kind of respiratory issues relative to those infectious diseases. Let's see, we have a question that comes in here. What causes a dog to lose its hair and bite it off? Okay, so there's a few different things to think about here. So the if we are losing our hair, that can happen for a few different reasons. It's normal for a dog this time of year to shed its coat. So there's at my house there is hair literally everywhere, and it doesn't matter how much I sweep or vacuum, it looks like I have done nothing 10 minutes later from the dogs. Um, so that is a normal thing that can happen. Other reasons that it could lose its hair and start to bite would be if it had a parasite infection. If it's a puppy, we would be thinking about some mites, like the scabies mite or the Demodex mite, that infects the hair follicles and the skin, and causes the hair to fall out, and the dogs can also begin chewing and scratching from that. If we have a flea infestation, dogs will chew at themselves and at their skin and at their hair because of those fleas. And some dogs have what is called flea allergy dermatitis, which is where, instead of being just irritated by a flea bite, they get an overactive immune response to it, just like when you have a specific allergy to cedar or whatever pollen. Um, your eyes and nose won't stop running. And for dogs, they get, for whatever reason, especially itchy right over their hips and at their tail head, and they will chew and bite at that area near their tail, and until the hair comes out and that skin just looks really red and irritated and scabby. So That is another cause. And then another reason could be just allergies in general. So if we had an environmental allergy. So, just like us, they're allergic to something in the environment, some type of seed, some kind of pollen. They will lick and chew at themselves primarily at their paws and at their ears, but they can also do that in other places. And then the other thing that can happen is if they have a food allergy. And this is where they are allergic to a specific protein in the food. And when that happens, then you need to begin a what's called an elimination diet, where you eliminate that protein that they may be exposed to. So, lots of answers, to, lots of possibilities to that question. The best way to get to the bottom of it would be to have your pet seen by a veterinarian so they can take a look, see what the pattern of the hair loss is, get some more information, and then start the appropriate diagnostics or treatment that we would need for our pet. Great question. All right. So, I had an interesting thing happen just this week, just yesterday, in fact. I had this big, sweet female pity dog come in to get spayed. And the story with her was that the owners had meant to have her come in months ago, 2 months ago, but she got lost. She ran off, she got lost, got out of the yard, was missing. And was missing for 2 months. Owners had no idea where she was, looked for her, could not find her. 2 months later, somebody found this dog and they scanned it for a microchip, and that microchip was the way that that dog found its way back home. The If that dog did not have a microchip, no one would have known whose dog it was or where it went. So I'm going to say that this is a fantastic reason to have your dogs, all of your dogs and your cats, microchipped. It is the most likely way that a lost pet will find its way back to you. We do microchips at Spay Neuter Network, and once that pet has the microchip, we have a needle that we use to put it between their shoulder blades, and it's a teeny little, looks like kind of like a piece of rice, and it has a little signal that can be scanned, and that provides a unique number to the microchip, and then that microchip is registered at the company. So when someone scans that chip, they call the phone number and say, hey, we have this dog with this number. And if you have provided your information to the microchip company, then they know exactly who to call and say, great news, we have found your pet. And you have a happy ending versus either not knowing, or you find out later on that your dog. I had somebody who was had been missing their dog for a few days and had been wandering around, and they found it that it had been hit by a car and had died, and they were very, very sad about that. So it is the a microchip is the best way to get your pet back if it ever gets lost. So I would recommend everyone have your dog microchip. That is a service that we can do also at our vaccine clinics this weekend. So something to keep in mind for that as well. Right. Let's see here. So we had talked a little bit earlier about deworming our dogs and how often we should do that, and mentioned that heartworm preventatives and flea preventatives often have a dewormer in them, so your pet automatically gets dewormed on a monthly basis. Most of our GI parasites are spread by contact with the ground, where the eggs are in the soil, and the dogs walk around and they will have their nose, their tongue in the soil, and they'll actually ingest the worms, or actually some of these worms are able to burrow through their foot pads and get infect them that way and find their way to their GI tract. So having them dewormed regularly is a very good idea. Here is a question: is a side effect of Albon in cats increased thirst? I have recently rescued cat who had smelly diarrhea when I got her. She had to she had to grab. I'd spay done last week. I completed a 6-day course of fenbendazole. Here we go. Wrapping up her Albon course. She's about 3 years old, drinks a lot of water, it seems. I refill her bowl, holds about a cup, and changes sometimes twice a day. She eats both wet and dry food. Stool is still really soft and could be okay, and could be from the out from the Albon. She's also on Proviable as well. Okay, so it sounds like you've got a lot of things going on with this with your cat. The big things here that I'm seeing are that so it's a cat that we rescued, kind of an unknown history, I would imagine, and it had some really bad diarrhea. So it has been we're definitely treating appropriately for the most common GI parasites with the fenbendazole and the Albon. Those both treat different things. The fenbendazole course has, I would think, cleared up whatever parasites she could have that fenbendazole treats. I think we're probably under control there. Albon is specifically for a microorganism that is called coccidia, which can cause severe diarrhea. And some animals require a longer course of treatment with the Albon. We will usually treat for about 10 days, but some cats require another 10 days of treatment on top of that. When you finish the Albon, it would be I would advise you to go and have a fecal test done on the cat and make sure that we have cleared any GI parasites that are there. Now, drinking a lot of water, if we're having diarrhea, then we are going to drink more water because diarrhea is literally excess water in the feces. So if we're having a lot of diarrhea, that means we're losing a lot of water through our GI tract. And that means that we need to drink more water as a result of that. So that does not terribly surprise me. It's not necessarily a side effect of the Albon. It is a side effect of the diarrhea. Um, the Proviable is a great thing for. Oh, okay, Gravispace. I see. Is a great probiotic that can help reestablish the normal GI flora. Great stuff. But if we still have parasites in there, it's only going to be of limited value. So I would complete the course of Albon, have a fecal checked, and see what we needed to do from there. Okay, let's see. How long do standard poodles stay pregnant, and what are the recommendations for pregnant dogs? Okay, so all dogs have a gestation rate length of about 60 days. It's actually 62, 63 days is the average. So basically 2 months from the time that they are bred and become pregnant until the day that they have those puppies. So if if we have a pregnant dog, there's a few things that I would recommend that we do, and this will probably wrap us up here with this question. One of the things is that the dog's energy requirements. Oh, she bred yesterday. Okay, so it may be a few days until we actually know if she is pregnant or not. If you don't want to have puppies, the best thing to do is to schedule her to have her spay done at Spay Neuter Network as soon as possible so that we can keep that from happening. And the sooner we do it, the easier it is on her, and there's less bleeding. So that I would make that recommendation right off the bat is if we can spay her and you weren't trying to have standard poodle puppies, then let's get that done. But if we are having those puppies, then we're going to want to move her onto a higher protein diet because she is using up so much energy growing puppies right now. So we want to move her onto a high protein diet to allow for those pups to grow, and then basically make sure she's we would be ideal if she's up to date on vaccines and also on parasite control, because we would love to not have puppies be infested with fleas the day they're born. Deworming her is a good idea because the GI parasites, some of them can transfer to puppies through the milk or through the placenta. And the as the time comes closer for her to have the puppies, we want to have her in a low stress area where she can nest and have those puppies without a lot of stress. So, kind of a short answer to sort of a big question. Once again, there's, if you're not planning on breeding her, there's so many extra puppies and kittens out there, and that's our big mission at Spay Neuter Network, is to help reduce those numbers of animals so that we do not have as many unwanted pets, pets that don't have optimum care, pets that don't have any place to go, and be able to provide wellness for all of our pets at an affordable cost. It's been great talking with all of you today. Everyone have a wonderful month, and we will see you again in a month. Thank you.